Welcome to the Artist of Science from Tokyo, Japan. It's an honor and pleasure for me to be here with Dr. Osamu Kimura in his clinic, where he is treating patients with his own developed original technique, immunotherapy. Dr. Kimura, again, it's a pleasure being with you. My curiosity, the first thing I would have asked you is, tell us something about your career, your successes in your profession.
Well, yeah, of course it's a long story why I started developing anti-cancer immunotherapy, which is really effective, especially for patients with advanced cancer. Those patients once was given up by the doctors, and their life expectancy should be less than 1 month or 3 months or so, and they are quite at a loss where to go. So yes, I tried something to some patients, and yes, I got so many difficulties. As you know, yes, cancer treatments, it's too difficult to treat, but some lights, yes, we saw, and what I've done was the effort to save people just in front of me, and I cannot tell you a good story why I decided to do this. That's the actual story. Mm-hmm. Yeah.
So what attracted you to cancer treatment? Why cancer treatment?
It's also a long story. Yes, actually, it may be so unbelievable story. First, I was maybe one of the most yes, I dislike untrustworthy ways in medical practice, and I thought it's nothing, yes, for the first time. And because, yes, when I was working in my university in Kyoto, there were some doctors who devoted themselves to investigate the possibility to cure cancer by immunotherapy, but results, nothing. So I thought it was nothing but research for the researchers, mm-hmm. Not the level to save people, to be able to save people. Yes. So actually, I didn't like to do anti-cancer immunotherapy. I did so many surgeries in pediatric surgery fields, but yes, it's a long story, and I can't tell you for the detail. But yes, some guy begged me to help them. And first, yes, I told them I didn't believe the effectiveness of the anti-cancer immunotherapy.
So you didn't believe yourself first,
yes,
with
yes.
the status of immunotherapy, yes.
Yes, and when I started, what I saw was quite the things. It's just the thing I expected, nothing. So I thought I should quit immediately. This is a real story.
Yeah.
And just before I quit, one patient came to me. I told the patients, it's nothing. Don't do this. Go back and enjoy your life, yeah, with your wife and children. Yeah. That's the only hope for you. But the patients told me, oh, you are so trustworthy guy. So I want to trust you, and I want to do the treatments only from you. I repeatedly persuaded him not to do this, but he eventually, yes, I have to accept his offer. So I studied so much how to do for him, how to help him, quite another way, by investigating papers and textbooks and many things. And it's quite strange for me that yes, I could successfully cure him in 6 months. So that's the
and he was suffering
from so advanced pharyngeal cancer. And he had so long-term chemotherapy in some institutions, and his doctor told him there are no more agents to use to help him. And in 3 weeks, his tumor getting larger and larger, and I thought yes, he could be dead in 2 weeks or so. But yes, as a result, I could successfully treat him. So I thought there's something, and yes, some possibility in immunotherapy for patients with advanced cancers. That's only the starting emotion I had there. And I repeated the same way, the same way that I could successfully treat that patient. But the effectiveness quite different patient by patient. So these 4 years, I had so much effort to elucidate why there were so many differences. Yes, 30% patients so good responders, and the 50% of patients moderate responders, but the rest 20% of patients or so, nothing happened. Why? So many people don't know about the real thing in the field of anti-cancer immunotherapy, as well as just as what I was. But yes, nowadays I think if patients ask me for help, I should do anything I can do. So I developed my treatment just only for that reason.
So, Dr. Kimura, you started cancer because of necessity.
Yes.
You're not happy of the status quo, what you were seeing around.
Seeing around?
What you were seeing around, the status of the immunotherapy. You're not happy what you were seeing around.
Yes. Because around me, there was only fake treatments. And what other people did was doing some ideal image. Making your immunity so strong may help curing cancers, and it's only the hope, and then it's not a science.
But when you say fake, means what exactly?
Because their insist was to inject some cells or some agents. It can kill cancer cells, or sometimes it can kill cancer cells. Its effectiveness will make standard chemotherapy more and more effective. No.
Yes, I understand.
Those things never happens because cytotoxic agents used in standard chemotherapy destroy our immunity, and concomitant immunotherapy and standard chemotherapy doesn't make any sense to me. So first I would like to know without chemotherapy, only anti-cancer immunotherapy may effective or not. So I told my patients stop having standard chemotherapy, and some of the patients were so afraid and denied. So I told them, forget about anti-cancer immunotherapy because you are having some poison to destroy your immunity.
Because chemotherapy destroys immunity.
So yes, and among the patients who agreed with me, they quit having chemotherapy and doing only anti-cancer immunotherapy. Yes, I did so many things, but yes, why usual immunotherapy or chemotherapy cannot save people with advanced cancers is that yes, they can only see one side of the treatments. They are considering how to attack cancer cells. Yes, of course, only in that field they didn't succeed yet. Mm-hmm. But yes, while progressing my treatments, mm-hmm. I could realize how important to see from so many different kinds of angle mm-hmm. to make patients cure. Mm-hmm. Yes.
So how you feel now? So you jump from your first specialty was pediatric, correct?
Yes, pediatric surgery.
It's pediatric surgeon, and then you jump from that because of the necessity, because you saw that you were not happy and satisfied with other people working on fighting cancer. So you wanted to give that contribution. Now at this stage, you have achieved so many successes. So in applying your immunotherapy developed by you, the immunotherapy is just a name, but technique is important, the way you do it is important. So how you feel today that you have so many successes, that people that lost their hope, they were told that they're going to die soon, they are still alive and they are doing their normal life because of your immunotherapy. How you feel of these successes?
Yeah, that's a good question. I think yes. My career, spending my life over 25 years as a pediatric surgeon, mm-hmm. so helpful to develop my anti-cancer immunotherapy. And because pediatric surgeon have to do some surgery, including thoracic surgery, abdominal surgery, yes. In my case, cosmetic surgery, so many surgery I had to do, and those experience was so helpful also in developing my anti-cancer treatments because my patients' cancer, some patients lung cancer, esophageal cancers, my cancer, liver cancer.
So all the children, children.
Yeah. So yes, my ability to be able to manage the all systemic problems is very helpful in developing my anti-cancer immunotherapy. Yes, it's true.
But how you feel today with all these successes? So you achieved many successes applying your immunotherapy.
Well,
it's a goal achieved. It's a
yes. There are so many hurdles.
Yeah.
There were so many hurdles. There is so many hurdles. There will be all the way. And every time I encounter some difficulties in taking care of my patients, I suffer from those problems at least a couple of months.
Okay.
Why what we have done was not effective for these patients. Mm-hmm. So to illustrate,
so it's a perpetual learning and developing.
Yes,
improving.
Because the answer is in the patient's body, not in the textbook.
Exactly.
So it's I think I make it a rule to focus on analyzing what's happening in the patient's body, and to explain what's happening. Yes, I have to read some papers and books, but books and papers are so important knowledge and information scattered, randomly scattered. So to integrate them, it is very important to think about solving patient's problem. So those way of thinking is maybe the most important thing to develop new treatments. Mm-hmm. Yes.
But so you feel you feel a little bit satisfied of your results until now? I know that you have to improve or other things, but you feel satisfied of the
Yes, yes, my satisfaction is still maybe 70 to 80%.
Yeah.
Because I can't treat all of my patients.
Okay.
The response rate now getting so higher, yes, maybe around 85 to 90%, but I'm not satisfied with this because there are so many things.
Perpetual unsatisfaction, that's a road to success.
Yes. Maybe, yes, the presentation and SIPS 2022,
Yeah.
I will present our incredible cases, just a miracle, but it's not a miracle. Very logically,
Exactly.
I'm doing. So the concept and way of thinking from different point of views is how important. Maybe yes, I will present those things.
Yeah, you're welcome. What I was thinking while hearing, so if you go back when you were a young student, and you had all different possibilities, so go back in time, would you have chosen the same path or something different? First of all, would you have chosen medicine?
Yes, actually, I'm not sure.
Why?
Because what I'm doing is so hard.
Okay.
Yes, some people, yes, in the United States, told me, "Oh, you are doing so good job, but it's a Japanese way. You're forgetting about your family."
Okay.
I worked so hard, so yes, in my next life, I don't know. Yes, I will choose. I would choose the same way. No, I'm not sure because it's too hard. It's too hard.
Yeah, but this is all the case. All the time with scientists and engineers, they work hard. Sometimes they don't get enough credit. So other professions get credits. So this is how we are trying to change this. So this is So this is actually you went by chance to my other question. So what could be a good balance between work and family life or entertainment or what? This is $1 million question, I know, but I want just your input on that.
Well, yeah, hardest question. Yes, maybe. Yes, what I saw most heavily on was my work, of course, and I told my family to understand what I wanted, what I do. And I don't know the foreign countries people.
No, this is just you.
Circumstances.
Not Japan, not Tokyo, just you.
Yes. Actually, yes. I want to make balance if I could.
Yes, and what could be that balance? What is the golden cut? No, I know, it's a very difficult question. I don't know, I do not know myself, by the way. So that's why I'm asking you your input.
Yes, in my mind,
Yeah.
in my mind, I should spend more and more time with my family. But
How much?
2 days a week or so, but
Yeah.
yes, it's quite difficult now. But yes,
Yeah.
if I cannot do my work I am interested in, and I can devote myself, I couldn't be happy maybe. So I'm not a good guy in terms of making balance in life.
Yeah, but you're very good making balance of cancer cells and immunity.
Yes. You're right. You're
Yeah.
right. Yes.
Yeah.
Yes. The most important thing is how to realize maintenance of the balance of the immune system.
Yeah.
Yes, but when it comes to in my life, bad balance.
Well, you remind me an engineer. It's a woman. She's very good. She's very good managing the reactor. at the company. She's in charge of 2 or 3 reactors. But one day when we were visiting them, she came with a burned finger. And I told her, what happened? Well, I am a very good engineer managing a reactor, but while I was cooking, I burned my finger.
That happens.
So this is the relation. Sometimes you're good at work, but she was not. That's her case. So this is, this is the beauty of finding out this balance that is always dynamic. Nobody knows actually.
Yeah.
Everybody, even people that say, okay, you should do this, you should do this. I'm curious to ask them question if they have applied those things. But how much free time you have normally?
Well, yes. Actually, I have yes. In my clinic, yes, 3 days off. But the 3 days off time, I'm doing another job.
In the hospital or?
I don't know. Yes, many people want to make what I'm doing into business. And yes, in addition to doing my practice here, yes, I thought I should do something to make money for reducing the patient's treatment fee.
Wow, that's amazing.
So the work range from earning money by some other business and making some funds to help people.
Okay.
Such kind of activities I'm doing the rest of 3 days. So I'm too busy now.
Okay. That's a very beautiful goal. So how many free time remains? So clinic, business, and that's good. I didn't know that you're a businessman also. I'm a kind of, so.
Yes, actually,
it's a good combination.
With my family, 2 days in a month, and my family stays in Kyoto city.
Okay.
And I'm living alone in Tokyo.
Oh, really? Okay.
So in that meeting,
why they don't come here?
Because they're also busy as I am. And yes, for that reason, yes, I can have enough time to read books.
Yeah.
After I go back to my home.
Yeah.
In Tokyo.
And why in Tokyo? Why not in Kyoto, the clinic?
It's just a coincidence. Because yes, there are so many patients when I opened this clinic in Tokyo.
Correct.
So
because it's a huge.
Yes.
And the link toward from different countries, everybody goes mostly through Tokyo.
Yeah. So many acquaintances in Kyoto requested me to open the same clinic in Tokyo. So I'm thinking now how to do this.
Yeah. So, as a scientist at the end, because you have both scientist and doctor, developing new treatment is being more a science and a doctor, but you have both. You have also, as I see, you have also, entrepreneurship as a. So that's good to know. But in all this, so busy in 3 levels. Any time left for hobbies? What are your hobbies besides medicine, besides business?
Well, yes. Besides business, besides medical practice, yes, I'd like to spend my time with my family and sightseeing, going abroad. I haven't seen everything still in my life. Yes, I want to go so many places. I've been to many places, yes, of course, including in the United States, Australia, Europe. But yes, the purpose is to attend our medical congress for short term. So I'd like to stay a good place to see what to have enough time. What is important in my life?
And that's a question that sometimes I ask myself also. So what was the longest vacation you took in your life?
2 weeks. Yes, for my honeymoon.
Yeah, so
That's the longest one.
That's the longest one. Wow, this is the issue with scientists and engineers and technologists and doctors. That's a fact of life. And sometimes, we create misconceptions to the young generation that they're saying, why I need to work so hard? Why not study so hard? Then I'll not have enough time to enjoy life. So what you would say to these young people that would have asked your advice? So why they should follow your example?
Well, yes, I think yes. This may be only my feeling.
This is you, just you.
Yes.
Not Asia, not Japan, not Tokyo, just you.
Maybe it's so difficult to distinguish job and what I'm interested in my life, because yes, when I'm doing a medical practice, yes, I felt some happiness. It's true. So
it's not work. It's a kind of you enjoy it.
Yes. As I told you before, after suffering from solving patients' problem a couple of months, and I saw something to solve them. It's quite joyful experience in my life, and I am now repeating it. I have been repeating it. So that is only our job. Yes, many people think job is something we have to do for earning money or making my life. Yes, doing my challenge in medical practice field is just the things I want to do in my life. So I can't distinguish my jobs from doing I'm interested in other than job. It's quite difficult.
So you enjoy both. There is no distinguish. You cannot distinguish between work.
Because yes, in medical practice, doctors have to do so many same things, repeat every day. So in that meaning, yes, I may be better at doing that. So I like challenging.
So that's a routine for you, and this is new development.
Yes.
So the challenging to achieve new things.
Yes, challenging and pursuing some new things is a part of my job and part of my life, and that make my life so meaningful. So that is what I'm feeling.
Yeah, perfect. So the young generation should follow your example this way, meaning that their work is basically also their something they like to do. It's not just work.
Yes, I also.
Not anonymous work, but it's something that they should like and doing it.
Yeah, challenging and finding something new is yes. In doing that, yes, maintaining our emotion to do it is very important and difficult. But in my case, it's not so difficult because the problem is always in front of me. Patients, I have to help people. So that's so helpful for me to maintain my emotions. Yes.
That's the difference between the medical doctors and other professions, scientists. Scientists, mostly the results of their work, it is, well, I'm sure some of are directly inhuman, but the scientist doctor has a real human being in front of him. So you are helping them directly instead of indirectly. The other scientists help indirectly, the humanity, etc. But you have a real person in front of you that you need to help. And how you feel about that?
Yes, it's a kind of what I feel happy because many of my patients, once given up by their doctors, So yes.
So you are the guy that make the surviving those that have lost the entire hope in life, correct? Because of cancer.
Yes. So many of my patients complain to me. First visit, they couldn't eat, and I explained what I'm thinking and how about the detail and logical steps of my treatments. And after that, patient can have some hope, and it's unbelievable. But I experienced so many cases, maybe more than half of the patients who first told me they couldn't eat, can eat after first visit. When they go back to home, they can have steak. Incredible. So yes, and I think I and family and my staffs surrounding patients and always make some team.
Mm-hmm.
So patients got so comfortable.
So it's part of the team.
Yes.
That is.
And if we success, the team, all of the team, so glad. And it failed, all of my team, so sad. But we could share something with them. That was an important experience. And after I lost my patients, I never forget, and I precisely analyzed the clinical course. And in some cases, I could see so important things in analyzing the patient's clinical course. I lost, but that's what I'm doing. Yeah.
So what's your, from all these years of career, what's your best decision you have done? If you can determine.
Well, yes, well, one of the patients who suffered from malignant lymphoma, and she quit her job and sold her house and prepared to die. She was a friend of my friend's, and she couldn't come to my office in Tokyo because she was so bad. And I met her in Kyoto Station Hotel, our tea room. She brought her data for 20 years. And I thought, yes, it's not so difficult. So I told her, yes, let's take one tablet a day. It's so reasonable price, and no side effects, only one tablet. She asked me, is it enough? I told her, yes, first you have to do it because your immune balance so distracted, you lost your balance. So first, I have to make the balance back to normal. And her abdomen so distended with our large amount of tumor. 20 days later, she called me. Oh my God, my stomach shrinked, my abdomen shrinked, and my appetite. I can't stand eating. Yeah. Oh, okay. So yes, let's do check it by the imaging study, and the tumor all gone.
So that's the best decision.
Yes. The cost, $30.
Wow.
And the stage 4 malignancy, all gone in a month. And
but this was the artificial. This was a new type of tablet, new medication.
No. Old one.
Old one.
See, the reason why it's so cheap, the reasonable price. Yes, it's old one.
And
it's very effective to decrease the number of regulatory T cells around her cancer microenvironment.
okay, so it goes directly at your specialty,
Yes.
at the heart of your
Yes,
work.
but yes, of course, yes. My decision to let her take one tablet a day for 30 days. Yes, of course. Is it the thing I will do the same way for the patients with the similar patients now? It's so doubtful. That because yes, she was so bad, but her data, I felt, told me that's the best way. Yes.
So it was your gut and analysis of your data you had.
So yes, so that's kind of things I experienced. Yes, after that, yes, science and art is just the expression to express them, those stories.
That's why what we're doing is artist of science.
Yeah. Yes. You can say that again.
And what is something that we can say, not probably a bad decision or something you regret and you would have done better or differently?
Every day.
That's good.
Every day.
Okay.
So little by little.
Okay.
Not a big yes. Yes. Other people don't think it's a mistake, but yes, I always so little difference. Oh, I should have done this. Oh, is it okay? I'm always annoying and always regretting and thinking what I did was right or not. I'm always thinking about it.
Yeah.
Every day.
Perpetual improvement. Well, so if you regret something, that means that you have a new experience in front of you. You learn from experience, correct?
Of course.
So this is the path to development. Well, and then if you would have been somebody from your family, you'd have told you, okay, would you like to have another profession besides medicine? What would have been your reply? If I can repeat the question. If somebody from the family would have told you, it's better you have chosen another profession, not medicine, what you would have told them?
Oh well, yes. Yes. The decision should be made by the patients and the family. It's okay, but yes, I think it is my duty to explain them what's going on in my clinic.
Okay.
And the choice depends on the patients and their family.
Yeah.
I don't care because I can't save all of the patients in the world.
No, I know, but saying so because the family might say probably it would have been better a lawyer, might be better economist than the doctor. This was my question. What would have been your reply?
I'm not sure. I'm not sure. Yes. When I meet economists, a businessman, and then a lawyer, their work fantastic.
Yeah.
Fantastic, and I can respect them all. And I
would you have would you have replaced medicine with law? Not so sure.
I'm not sure. Everything is yes. Everything is yes. That's something fascinating to devote myself.
Yeah.
And so yes, it is just coincidence that I am doing medical practice.
Coincidence? Why?
Because when I choose my career, yes, I could choose many fields. But yes, even me myself, I don't know why I have chosen to go to medicine.
But you don't regret that?
Yes. When I see someone so successful in their own fields,
yeah,
I'm always regret myself.
Well, you are achieving so many successes in the immunotherapy, so Well, sure, it's hard, but that's what you said. I mean, it's every day a new challenge, and that's development.
Yeah, yeah, because I have to do. Yes, I have to do to save people in front of me, but it's not only the way to save people. Yes, economy, a business.
Well, that is a different type of helping.
Yeah, yeah.
But yours is direct help. This is life or death. So this is completely different.
I've never thought I can replace my work. Yes. Yes. The reason why what I'm doing in medical field is just coincidence. Is that I've never thought if I am doing some other jobs instead of doing medical field. No, I've never thought.
Mm-hmm.
So, but yes, actually, I'm doing some business.
Yeah.
Yes, relating to healthcare world.
Healthcare.
So
Yeah.
Yes. I don't think my choice was too bad.
Yeah, no, well, that's I see that with the successes you have been achieving. That's I think you will not regret. But what I was saying, what about the family? They are they in medicine?
No, no one.
No one.
I have 3 daughters.
3 daughters, and
Yes.
which field they are?
Yeah, yeah. I always told them, never think to be a doctor.
Why?
It's too hard, and it's yes.
That's interesting. Because it's too hard work.
Yeah, yeah.
Well, but as you said, there are doctors and doctors. There are some doctors that just deal with routine. But there are some doctors like you that like challenging, developing new treatments.
I don't want my children to challenge like me.
You don't want your children
To challenge like me.
to challenge you like
because
you. Why?
Yeah, the challenge is yes. I have to have so big energy and passion.
Yeah.
And if I want to make my daughters to do this, it's so yes. It could be a burden for them.
Yeah.
So I don't want to do that. So.
That's interesting. So, but it is good to have a family not in the same profession. For example, husband and wife, not both doctors.
Yeah.
Oh, is good or is bad? It's good. Which one is the?
It depends on the
I know,
relationship.
sure, but just generally, just an idea, just a funny side.
Yeah.
It's better to be complementary in different professions, or to be both doctors and speak about medicine even home.
Yeah. No answer maybe. No answer. It depends on the relationship between.
Yeah, sure, but it's just your own opinion.
Yeah.
You know?
Yes. In my case,
Yeah.
yes. My wife.
Yeah.
I got acquainted with her in my high school days, and in that time, yes. At that time, I didn't think I would be a doctor.
Mm-hmm.
So I never thought the best couple of the husband and wife with some other kind
So
of
that was a
or some kind
coincidence
of.
Yeah, there was not.
I've never thought. So
Sure,
what
in the
do you think?
beginning, but after this year it's good because I ask this question all my, university professors that I know, and I say, okay, if you are both chemists, do you speak every day about chemistry?
Too tired. Too tired.
Or it's better to be different profession and speak about nothing
Boring.
Completely different from work. So there are different replies, different impressions. That's why I wanted. That's why I was asking you also. So you would prefer both doctors or different professions?
Yeah, maybe.
Maybe different.
Maybe different.
Maybe different. So or complementary, then in the same level.
Yeah.
Yeah, that's good. That's good. Well, Dr. Kimura, this was a very interesting conversation. It is very good to know, the background, the human side of scientists and doctors. We normally, and people do not know what hard work it is. And sometimes, the work is like, I say, it's like horses, but the credit is like mouses in the public domain. So that's why we are trying to change this. That's why this conversation. We should give people a great picture of these people that actually developed the world. So again, it was very interesting. It's a pleasure and honor being with you and having this chat. And I would say something: if you are a baby, would you like to be a baby or to be at this age and so successful?
Yes, it's very interesting. Yes, I sometimes thought the same question. Yes, every time I see a baby, so happy.
Exactly.
Because baby don't know anything. What the baby has is only hope for their future. But yes, baby can't stay baby. So after experience so many things, I don't want to be a baby.
Perfect.
Anymore.
And with this great highlight, we finalize this. Again, it's a pleasure and honor
Me too,
being
it's a
with
great
you.
honor.
It was very interesting, and thank you very much.
Thank you.
And I wish you a lot of successes ahead with your new developed immunotherapy and the help of human beings that you have always in front. Thank you again.
Thank you very much.
Thank you.
Thank you.